Hi, my name is Ron Shapiro. I am Professor of Surgery, Robert J. Corey Chair in Transplantation Surgery, and Director of Kidney, Pancreas, and Islet Transplantation at the Thomas E. Stargell Transplantation Institute. I want to talk today about a complicated paper that addresses an important issue in transplantation. This is a paper from the March HAT by Wine, Handel, Snyder, Israni, and Bert Kasiski, looking at the effect of comorbidity adjustment on CMS criteria for kidney transplant center performance. The background at some level is that as transplantation has matured, it has become bureaucratized, and there are all sorts of expectations of what outcomes will be like. The reality is that there has always been a variability in the way different transplant programs behave. Some programs cherry pick and will get wonderful results by transplanting relatively small numbers of patients, very highly selected with very small numbers of organs, and do very well in terms of their outcomes, but not really serve their patient population. Some centers are very large and are willing to take chances and transplant patients that some other centers would not transplant, and will pay a bit of a price in terms of outcome, but take a philosophic view that the goal is to try to transplant successfully patients who might benefit from the procedure and not to worry about picking perfect recipients. The analysis by Kasiski and his group looks at this very question and suggests that looking at comorbidities is important in analyzing center-specific outcomes, because some centers, in fact, are willing to take chances while other centers are not, and it is not clear that the evaluation of outcomes takes this into account. The downside, of course, is that centers will wind up throwing potentially viable candidates, but high-risk candidates or higher-risk candidates under the bus and not transplant them. And at some level, I believe that this would be a disservice to the patients and to society. This paper is very complicated and very mathematical and is difficult to understand because of its very nature, but I believe that it is an important contribution. Thank you.